Today, I want to update you about where we are regarding boosters for fully vaccinated individuals. Our top priority has always been protecting people and their families from COVID-19. And we have been fortunate to have safe, effective vaccines that offer outstanding protection against the worst outcomes of this virus: severe disease, hospitalization, and death. The COVID-19 vaccines that are authorized in the United States have been remarkably effective, even against the widespread Delta variant. But we know that even highly effective vaccines become less effective over time. Our goal has been to determine when that time might come for the COVID-19 vaccines so we can make a plan to take proactive steps to extend and enhance the protection the vaccines are giving us. Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021. I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines, and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence. The plan ensures that people who were fully vaccinated earliest in the vaccination rollout will be eligible for a booster first. This includes our most vulnerable populations, like our healthcare providers, nursing home residents, and other seniors. We will also begin delivering booster shots directly to residents of long-term care facilities. For people who received the Johnson & Johnson vaccine, we anticipate vaccine boosters will likely be needed. The J&J vaccine was not administered in the US until March of 2021, and we expect more data on J&J in the coming weeks. With those data in hand, we will keep the public informed with a timely plan for J&J booster shots. I want to emphasize that this decision was not made lightly. It was made with careful consideration by the top medical and public health experts in the Department of Health and Human Services. It was informed by data, thoughtful analysis, and by our collective years of experience addressing illness and epidemics. As always, we will continue to follow the science on a daily basis, and will take whatever steps are necessary to protect our nation from COVID-19. This plan to administer booster doses does not change our commitment to vaccinating those who are not yet vaccinated here in the US and around the world. The overwhelming majority of hospitalizations and death continue to occur among the unvaccinated. We will continue to ramp up efforts to increase vaccinations here at home and to ensure people have accurate information about vaccines and access to vaccinations. We will also continue to expand our efforts to increase the supply of vaccines for other countries, building on the over 600 million doses we have already committed to donate globally. We understand well that global pandemics require a global response and strong leadership, and we will not stop until America and the world are vaccinated against COVID-19. I'm speaking to you today as your Surgeon General, but most importantly as a fellow American who has felt the pain of losing family members to this disease, and who hears each day the stories of people whose lives have been upended and forever altered by COVID-19. The brave doctors and nurses in our hospitals, the teachers working to get our kids back to school, and the frontline workers who have put themselves on the line to make sure we can get groceries and supplies. We all want this pandemic to be over. And right now, our quickest path to getting COVID-19 under control, once and for all, is getting vaccines to those who need them as quickly as possible. So here's what you need to know. If you are fully vaccinated, you still have a high degree of protection from the worst outcomes of COVID-19, severe disease, hospitalization, and death. So we are not recommending that you go out and get a booster today. Instead, starting the week of September 20th, fully vaccinated adults could begin getting their booster shots 8 months after their second shot of an mRNA vaccine. And finally, all of us must do everything we can to protect our communities from COVID-19. That means encouraging our family and friends, our patients and students, our coworkers and neighbors to get vaccinated. That is our path to ending this pandemic.
Sanjay, just your reaction and your take on what we just heard.
Well, they're making the case that there's some evidence that there's a waning effectiveness of these vaccines against mild and moderate symptoms. So not severe symptoms, certainly not severe enough to get you in the hospital. There's still a lot of protection against that and preventing people from dying. What they seem to be saying, and it's an interesting sort of discussion here, because they're saying, hey, look, we're trying to get ahead of this because we've seen some evidence, and this is U.S. data that they're presenting from nursing homes, from hospital systems, from a large number of people in the general population. They say, since we're seeing this decreased effectiveness against mild or moderate disease, we're worried that will start to translate into decreased effectiveness against hospitalizations and death. Haven't seen that really yet, but that's the concern. It's an interesting point, Kate, and I mean, it's going to be a subject, I think, of significant discussion because for so long the message has been until we see decreased effectiveness against hospitalization and death, and that's clear, we probably won't be recommending booster shots. Other people have said, look, booster shots were always going to be part of the plan. The messaging has been confusing, Kate, I can tell you.
And you wonder if it's, as we see how long it takes for people to go out and get a shot. Maybe they're trying to see, you know, they can see, I don't know, they can see the danger ahead. They're trying to kind of meet it there with these booster shots and rolling it out. I thought it was interesting exactly what you pointed to when they said they wanted to stay ahead of it. We have a graphic of what they showed that probably best sums up the decrease in the vaccine effectiveness that is leading them to this conclusion, right? Prior to Delta, you see 92% effectiveness against infection, and now they're looking at 64% effectiveness against infection. Can you put this into English, what this means that they're saying? What do you see with this, Sanjay?
Sure. Yeah. I mean, so it's a really important point, decreased effectiveness against infection. And I don't know if you notice when you listen to Dr. Walensky, she really stressed that against infection because when you say infection, we know that there are people who may have infection and have mild or even no symptoms, and there are people who have infection and have significant symptoms. They didn't really stratify that out. So just in general, we know that, that graph basically shows that the likelihood someone could test positive and have no symptoms all the way to test positive and be in the hospital could be reflective of that number. It would be nice to know how much of it is in each population, how much decrease was there really in terms of protecting against severe disease. What we know is from the other studies, besides this one, is that it seems pretty protective still against hospitalizations and deaths. So the majority of decrease in efficacy has been against mild or moderate disease. That's what that really means. I will say that the Delta variant has seems to have accelerated some of that decrease in protection. That's another point they made.
Dr. Marty, what stuck out to you? What sticks out to you from this briefing?
Thank you so much. First of all, I have boots on the ground, and I can tell you exactly what's happening. Right now in Miami-Dade County, 20% of the people in hospital are people who are fully vaccinated. So I need to make it very clear. And of course, that does reflect that we have a high percentage of individuals who are high risk for a variety of reasons, especially a lot of elderly people that live in our community, a lot of the transplant patients, et cetera, which are the vaccinated group that's most likely to be in hospital. We have to be very clear. Also, being a lab director for a high complexity lab, which is another hat I wear, I can tell you that I have seen the CT values on fully vaccinated individuals with mild and moderate disease, and they are sky high. So this decision and the presentation made by Dr. Fauci, Dr. Walensky, and Dr. Murphy were outstanding and incredibly valuable. But we very much need to be giving these third doses to those individuals who absolutely didn't get an initial first rise. That's the group that was talked about last week. And we need to give boosters to those of us whose immunity is waning.
Dr. Hotez, I want to get your take on this, because I believe what Dr. Fauci said is that the increased antibody levels after the third dose are by at least tenfold. Talk to me about what that actually means.
Well, I think that they actually missed some good opportunities to communicate this more effectively and to actually, show the American people that they're more on top of this. When these vaccines were rolled out back in December and January, and I'm sure Dr. Marty and Sanjay, Dr. Gupta remember this, it was done at a 3 to 4 week interval. And the reason that was done, the first dose and then the second dose 3 to 4 weeks afterwards, depending if it's Pfizer or Moderna, the reason for that was we were in crisis. We were having 3,000 hospitalizations a day. We had to fully vaccinate vulnerable people as fast as possible. And we did that, and that was extremely successful. At that time, we knew that was a crummy vaccine schedule for giving long-lasting protective immunity. And the minute that commitment was made, and again, it was done to save lives, and it was the right decision, but that already set into motion the fact that we were going to need a booster, whether it was a year from now or 6 months from then or a year and a half from then. And that's how I think it should be framed, that this was predicted and predictable, and it was just a matter of watching when we were going to start seeing a big bump in breakthrough cases and ultimately breakthrough hospitalizations that we pulled the trigger on giving the booster. And we've seen that data now come out of the Mayo Clinic, New York State, it was mentioned, and we've been watching this out of Israel now for a few weeks, where they've shown the protection against infection has gone down from 95% down to 40 to 50%. They made the statement they haven't seen the breakthrough hospitalizations, although I tend to concur with Dr. Marty. Anecdotally, we're hearing about quite a number of breakthrough hospitalizations. So I think the whole point was this could have been framed as something that we knew we were anticipating, we were getting ready for it, and now the data is showing up. Now's the time to do it.
Sanjay, kind of where we had kind of cut off before the briefing started, I'm wondering your take now if you think they effectively kind of conveyed and explained this enough in order to not contribute to further skepticism amongst those who are still resisting to get the first shot.
Yeah, I think that's it's a concern that they raised when I've talked to some of these officials on background. That was something that they were concerned about. Dr. Hotez makes this case that this was always sort of part of the plan, but as he said, I don't think that was communicated. I don't think people thought that was always part of the plan. Even recently, we heard people saying there's no plan for boosters. There's no imminent booster needs. All of this, just within the last few days, we've heard that. This obviously is different. So it's not been communicated well, I think. Now, sort of going forward, the idea of what this means, in terms of how people are going to get their shots, who should get their shots, I think they're going to have to be very clear on that. And also, the FDA and the CDC still need to, weigh in on this. The FDA needs to authorize this, safety data, efficacy data, all of that they look for typically.